This is the last video in the RSI series, and this is about having a surgery. Now, that is the last thing that you would like to have in your RSI treatment. And I had a wrist surgery because I ended up injuring my wrist to an extent where I had a partial ligament tear, and my doctor had to do an arthroscopic surgery to fix it because it was consistently in pain. Now, for example, if you can avoid surgery, that's best. But if you are at the extent where you have no option but surgery, I'm going to tell you certain things which you should know in advance and which your doctor is not going to tell you. And that is, the doctor will always tell you that you'll get better in 4 to 5 weeks after surgery, but that's not the truth. I mean, if you are having carpal tunnel surgery or having surgery for ganglion cyst excision in your wrist or for ligament tear, I mean, that's not going to get better in 4 to 5 weeks because your hand will be in plaster, and once the plaster is taken off, your wrist will be completely stiff and you'll not be able to move it. For example, I had a surgery here. If you can see, there are these 2 marks, and I didn't have a complete cut here. The doctor had done an arthroscopic surgery. He inserted camera from one point and a blade from another, and he fixed it. But after having things in a plaster, now my hand is slightly stiff because this is the good one which I can bend, and this is not the good one. I cannot bend it as much as I can, and I'm trying my best to bend it down, but it's not. And similarly, the movement backwards is not as much as the good one. So if you are having wrist surgery and thinking that after that you'll get better within a month or so, that's not the reality. It will going to take you time, and the physiotherapy is going to be even more rigorous than the one that you get for RSI, because your wrist will be completely stiff and the physiotherapist will give you immense pain to mobilize it, and that's the worst part about having a surgery. I'll suggest, unless you come to go to an extent where your wrist is having some kind of ligament or tendon tear, do not go for surgery. Go for conventional things like physiotherapy, because a wrist surgery is not easy to maintain later on. I hope this will help you out.